Oh, this is Mr. McMurray back again, and we are going to talk some more about the digestive system and finish that up real quick. We're talking about the pancreas, and the pancreas can secrete insulin if you're hyperglycemic, which means you have too much sugar in your blood, and normally your body would make insulin. The insulin would tell your body for your cells to start taking it up, for your liver to start taking it up, other ways of getting it out of your bloodstream. And that's why people who have type 1, their body does not make insulin, therefore they can take insulin shots to do that for them. All right, now that's normally what most people think about when they talk about diabetes. However, type 2 is actually becoming more and more common, in fact, almost to the point of being considered a pandemic-y kind of thing, because in places that have what we call a modern lifestyle, which means fast food and processed foods and so forth, they have found that there's a great increase in type 2 diabetes, which means later on in life you become what we call insulin resistant. In other words, your body just ignores the insulin that it makes and doesn't take the insulin out, possibly because we have so much sugar in our diet that it just overwhelmed our system. If you think about it, naturally you would only have occasional fruit or something like that, whereas we're eating candy bars and Cokes that are just massive doses of sugar. And if we do that on a regular basis over time, our bodies become resistant to that insulin, trying to lower that back down. Kind of like your body says, fine, if you're eating all this sugar, I give up. I did my best. I tried hard, but I just quit. And it's becoming extremely common in people that are older. Now, since you have, people get older, since you are, it's not that you're not making insulin, your body's just ignoring it. Taking insulin does not do any good. And so, although they are coming up with some medications that help, once again, unfortunately, we need to, probably the most effective way is just to eat food with less sugar and cut down on your sugar intake. And trying to really encourage people to do that when they're younger so that they do not get type 2 diabetes as they get older. All right. And the other thing your pancreas does is it secretes glucagon. Okay, think glycogen or glucagon. It's just the opposite. You want to get rid of, and when you do not have enough blood, you're hypoglycemic. Sorry, here we go. Hypoglycemic, and this time you're dumping sugar back into the blood. If it gets too low, that can be just as serious as having it too high. However, this is not very common, and a lot less likely that someone's going to have too low. But the main thing, you don't hear about glucagon, whereas like insulin you hear about because people get diabetes. Insulin is the only thing that will lower your blood sugar. And so if it's not there, then you have diabetes. Okay, there are other things in your body that will trigger that. If there's not enough sugar in the blood, there are other things that will trigger that and get that done. And so even if you didn't make glucagon, there's probably other ways your body would take care of it. And so it doesn't cause a disease or a condition like diabetes. And so you don't hear much about it. All right. Now, going back to the intestines, we've talked about it a little bit. Let's go a little bit more detail. Your whole intestines is anywhere from about 7 to 13 feet long. It depends a little bit. Depends if you measure it in the body or outside the body. Can kind of stretch out after, if you were to just cut it out and spread it out, it can be a lot longer, seems like. It can get kind of stretched out after it's dead. But anyhow, about 7 to 13 feet long, depending on the person. Now, it's technically the small intestine, but it's not the short intestine. It's there. You have more or longer small intestine than your large intestine, but we're really talking about how big around is it. Okay, it's fairly small around, whereas your large intestine is a lot bigger around, and that's really where the small and the large comes from. It's not the length. Your small intestine is quite a bit longer. Okay, your duodenum, the first one, we said duodenum means 12 because it was 12 finger lengths long, and so surgeons would measure 2, 4, 6, 8, and so that way they wouldn't cut into the duodenum. All right, and that's only about 5%, though. It's a very short part of the small intestine. All right, the jejunum, which is the next part, jejunum technically means empty. Don't ask me exactly why it's called that, but that's what it means. It's about 37% or over a third of it. And finally, you have the ileum. Ileum can mean intestine. It can also mean twisted. So the twisted intestine, probably a little more rolled around in there, but it's almost 58%, over half of it. So the most of your intestine is the ileum. Now, We've already talked about, but you might want to make a note. The duodenum is where digestion takes place. The pancreatic juices, the bile from the gallbladder, and so forth, breaking things down and digesting it. So you would expect the jejunum is mostly absorbing that. The ileum continues to do that. It absorbs the food in. It also absorbs some intrinsic factor or bile salts and some various things, vitamin B, and other things back into the body. But the main thing is still, once again, being absorbed food back into it. All right. Now, in order to help that, whoa, got a little carried away there. You have villi and microvilli. We'll look at a little picture of that. But villi, remember, are on the edge of the thing. You have little fingers, okay, that help absorb and increase the surface area of it. And you have Peyer's patches. These are actually not inside the small intestine. These are on the mesentery. So here's your small intestine. You've got the mesentery stretch. There's little patches of tissue on that clear membrane, and they're called Peyer's patches. And they're kind of like lymphatic tissue. They're akin to your immune system, and their job is to get any bacteria that escape in the area, to collect those and get rid of those. Okay, so they're kind of fighting infection. Think about it. Your intestines have large number of bacteria in them because you have basically digested food sitting there just waiting to be eaten. Okay, and a lot of this bacteria is probably a good thing. It probably breaks down, it helps digest our food and break it down and so forth. But if they get out of the intestines, then they can cause serious problems. Okay, and so that's kind of what they do. The Peyer's patches help kind of clear that up. All right, now if you're looking at this is your small intestine. See the blood vessels that come off the mesentery to each little section of it. You got arteries and veins. Bring and take back blood. Okay, inside the intestines, obviously, you have muscle walls to help push food down, but you have these folds in here, and on these folds, you have all the little fingers. Okay, and those are the villi. Okay, but if you look at the villi up close over here, at each of those cells on the edge of the villi have what we call microvilli, or little tiny things. So once again, not only these fingers increase the surface area, on the ends of them you have little more villi, microvilli, little villi, that even increase how much you can absorb even more. Okay, so if we just had a straight tube going through our bodies of the intestines, we might not have enough surface area to absorb enough food to keep us alive. But all these villi, with the microvilli on them, you've got little extra places to absorb, and that helps us to absorb more of the food that we need. All right, the large intestine is basically about 5 feet long, so not real long. It absorbs water back in the body. That's one of the main things, and eventually eliminates the waste products that are left over. If you get diarrhea, it's usually a bacterial infection of the large intestine, and basically it causes the food to move through faster. If it does that, then it doesn't absorb all the water back, and you have some degree of diarrhea. Okay, now if it stays too long in the large intestine, then it can soak up too much water, gets hard, and you can become constipated and be hard to go to the restroom because it's so hard. So there's kind of a balance there of you want all the water back. If you have diarrhea, before long you can become dehydrated. Why? Because you're losing a lot of water you normally wouldn't out through the large intestines. All right. Now, this order, we'll look at a picture here in a minute, and you will not have to label this kind of a picture on the test or quiz tomorrow or digestive, but you will eventually need to know this. So the cecum or appendix is the first part. That's where the small intestine comes into the large intestine. Okay. Then you have the colon, but on us, our colon goes ascending, transverse across, and then descending. And you have a little S shape over here, the sigmoid colon, and then the rectum where it goes straight down, and then finally the anal canal where it goes out. All right. There's not as much villi here as there is in small intestine because we're not really absorbing nutrients. Mostly we're absorbing water and stuff. There's a lot of mucus to help things move through better, I suppose. And so that's kind of basically, it's not so much absorption and stuff like the small intestine would be. Now, when we get rid to excrete the waste products, we have two sphincter muscles. One is external and it's called the voluntary sphincter. This is when you go to the restroom or you decide to go to the restroom, you open that and allow yourself to do a number 2 or allow feces or stool to go out. Okay. You also have an internal involuntary sphincter. Okay. And this is one that you do not control. If you were, say, kidnapped and tied up or something and you couldn't do anything about it, your body would eventually at some point say, look, it's got to go. Okay, we can't keep this in anymore. It's being pushed out, and your involuntary sphincter would override your voluntary sphincter, and you would go poop, because eventually it has to happen. Okay, and the same kind of thing applies to your urinary bladder. Okay, eventually your body's going to say, look, this is going to happen. Okay, we can't stop it. And so you do have voluntary control over it to a point, but then at some point the involuntary sphincter would kick in and say, there we go. All right. A couple other things, we've kind of talked about these, but mesentery just holds the intestines in place, keeps them from flopping around inside there. It also supports the veins and blood vessels, arteries and blood vessels that veins that carry food, that they carry nutrients and stuff to the intestines, and they also carry away waste products and oxygen and so forth. Now, the other thing is the veins, though. Veins are headed back to the heart, leaving the intestines. And so since they're absorbing all this stuff from the intestines, their job, they tend to go to instead of going straight, veins tend to go back to the heart. These actually go to another vein called the hepatic vein. Hepatic has to do with the liver. So it carries the food back to the liver, and the liver will either store them if they need to, or decide how much of it needs to go into the blood, and so forth. Okay? So that's basically kind of how that works. Mesenteric veins carry blood to the hepatic or liver veins, which carry it to the liver, and that's where they can either be stored or sent on through the system, or however they need to do. All right, and that's basically it for the notes for the quiz tomorrow. Now, I just go over this picture real quick. We'll go over it again. We do the human, but just to remind you, you have the small intestines. Small intestines will be all wrapped around in this area here. Okay, and when they come into the large intestine, the first thing is the cecum, which is this little sac off here. And we have what's called a vermiform appendix. Vermiform means it looks worm-like, so it's a little squiggly thing here. That's your appendix. If this gets infected, appendicitis, it swells up and it can eventually explode. Okay, if it explodes, it usually collects bacteria, and it's kind of like a lymphatic organ, kind of like your lymph nodes. It kills bacteria and stuff like that. If it explodes, though, now you've got bacteria scattered all inside your body cavity, and that can be extremely serious. Okay, so anytime you ever get a pain in your lower right side there, it might be worth checking out appendicitis. If they get it before it blows, then it's easily removed and no big deal. But if it blows up, then you got bacteria, and it can be a long time, and maybe my mother, for example, did that. She was in the hospital for weeks, almost a week, because in very bad shape. All right, so then you have the ascending colon, because it's going up. Then you have transverse going across, and then you have the descending colon coming down. Now this section here looks like an S, kind of laid on its side. You S curves here, comes back over here, and curves there. So this is called the sigmoid, which is just kind of like the Greek letter S. So it's S-shaped colon, sigma. So it's a letter, but it's S-shaped, so it's sigmoid colon. And then you have the rectum where it goes straight, and then of course you have the anal canal where your external sphincter, and there'd be the internal one as well. All right, and that is it. So hope you had a great day, and we will see you on Tuesday.